This lecture is going to cover propagation artifacts. Propagation artifacts make up a good chunk of the types of artifacts that we will see in our images. You will need to know all of these propagation artifacts, what assumptions they are violating, and how to correct for them. The propagation artifacts that we'll be covering today are reverberation, ring down, mirror image, multipath, refraction, lobe, speed error, and range ambiguity. Reverberation artifact is going to be displayed as multiple, equally spaced echoes deep into the image. This is going to be caused by a sound wave bouncing off of two strong reflectors. Those two strong reflectors are typically anatomy to anatomy, anatomy to transducer, or a metal foreign object to the transducer or anatomy. So basically you just have to have two interfaces that are very strong reflectors, and sound is going to bounce in between the two. The result is then reverberation. For example here, this first line here is a needle doing a thyroid biopsy. This needle is the first strong reflector. The second strong reflector is actually the other half of the needle. Biopsy needles are hollow, so the sound is actually bouncing in between the edges of the needle. What relates from that then is this reverberation artifact where we have equally spaced echoes throughout the rest of our picture. You can see through this mechanical valve here on the mitral valve is again another strong reflector, and we get equally spaced reverberation artifact behind it. So again, as the sound enters the body, it'll bounce off of a strong reflector. It'll return to the second reflector and bounce off of that, allowing some information back to the machine, but most of it reflecting back to the first reflector. This is going to continue as it slowly attenuates. The result of this bouncing back and forth of the sound is equally spaced artifacts with increasing depth due to the machine calculating that depth based on the presumed go-return time. As each echo takes a little bit longer to come back, the machine thinks that it's a little bit deeper. Eventually the attenuation will cause a decrease in the brightness as the artifacts are displayed deeper. So our sound comes out of our transducer and hits our first real reflector. If this real reflector is super strong, it's going to send a lot of information back to the transducer. The transducer, in this case, also happens to be a pretty strong reflector. So it's going to send some more information down. And again, they're just going to keep bouncing back and forth, back and forth, back and forth. As that back and forth happens between the strong reflectors, the machine is going to think, oh, hey, this echo took 26 milliseconds to come back. I better put something a little bit lower. Oh, hey, that next one that just came back is 39 microseconds. I better put another bright echo a little bit lower. Oh, hey, that next one came back a little bit longer. So as it takes longer and longer for those reflectors to bounce back and forth, it eventually will be displayed deeper and deeper into the body. The main thing with reverberation is that they are equally spaced reflections. So question, if the real reflector is only 1 centimeter into the body, what depth is the second artifact? So remember, we've got our real reflector, here's our first artifact, and here's our second artifact. And everything is equally spaced, right? So if this is 1 centimeter, this will be at 2 centimeters. We can see that this will be at 3 centimeters. So the answer to our question is that it is 3 centimeters into the body. Another question, what assumptions are in violation? Go back to your first answer on your first video guide question and look at those violations or assumptions that you had to write down. Which one does it seem like it's violating? In this case, it's that sound travels directly to a reflector and straight back. The machine assumes that it's going into this reflector and going back, but when in reality it's bouncing back and forth between them all, so it's not doing a direct travel. To correct this, we are going to want to decrease our TGCs in the near field, maybe take some of the strong reflector quality of that first reflector out, change angle so we're not hitting that first reflector with so much sound, or change our window. Ring down artifact is also known as comet tail, and it actually looks a lot like reverberation, except for all those equally spaced lines are really, really compact. They're still equally spaced, but they're super, super close to one another. So what it ends up looking like is an echogenic line that extends along the sound beam path from the reflector. So here's our example. We have our reflector right here. This is all comet tail artifact coming straight from behind it. So it looks like a nice bright white line. This is not a true line. It's not true anatomy. That's why it's an artifact. And again, it looks a lot like reverberation with all the spaces squeezed out. What happens with this is it's caused by the sound wave bouncing off of two strong reflectors that are very, very close to one another. Oftentimes, this is going to happen between crystals and foreign objects. We get a different ringing of those crystals, which are going to cause their own vibrations, and it's going to be detected by the machine, so it'll create that comet tail going behind. Also happens often when sound interacts with gas. Gas has kind of these round little shape molecules to them, and as those molecules come together, what we end up getting is kind of this voided area, and we call it a bugle. So it's a little bit of a bugle shape, and as the sound enters into that bugle, it's going to bounce in between all those little walls and send a strong frequency back to the transducer. So we call this the bubble tetrahedron theory, this bugle shape. And all you need to know is that as sound enters the space in between gas, it bounces around a lot, causing that comet tail. So here are some examples of how we see ring down or comet tail artifact in our everyday imaging. This first picture up in the corner here, we can see little ring down artifacts coming out of the biliary system. This is a diagnosis aider in that this little comet tells us that there is air within the bile ducts, because we know that the sound is interacting with the air, causing that bubble shape, those bugles, for the sound to kind of bounce back and head back to the transducer. So this actually helps in aiding our diagnosis. Similar to that, this is a gallbladder, and within the gallbladder wall are little crystals. And these little crystals of cholesterol ring at a different vibration, which makes the ultrasound machine think that the sound is much stronger than it is, so then we end up getting these little comet tails coming out from behind these crystals. Again, this is helpful in diagnosing adenomyomatosis. Another place that we see it really commonly is along any interface that there is air, so typically with the lungs. Here we have the diaphragm, and right behind it, we're getting a lot of artifact coming off of the lungs, all these little comet tails coming down as that sound is trying to figure out what to do in the presence of air. The other example that we had was that if you have a needle, again, that sound is going to bounce in between the edges of the needle very closely together. We're going to get this comet tail effect behind it because it is very, very closely spaced reflectors. So again, with comet tail, same thing as reverberation, but it's going to look more like a solid line coming down with all those little spaces squeezed out. Reverberation is going to be more widely spaced reflectors, but equal distance apart. So with mirror image artifact, it would stand to make sense that we're going to have images that appear as a double image. One is going to be real and one is not. The second one is caused by the sound beam reflecting off of a strong reflector and then intersecting more reflectors before returning to the original strong reflector and back to the transducer. So this artifact is deeper and along a straight line into the true anatomy. Typically we can see it in grayscale, but we also see mirror image artifact in pulse Doppler and also in color Doppler. It's also worth noting that typically the mirror image artifact overlies an area of gas. So here we have our liver, and we have our strong reflector, which is the diaphragm. If you look across the diaphragm, we're getting that mirror image. We can see the lesion over here and then liver, what looks like liver tissue on this side. So our mirror image is coming across that diaphragm. For it to be a true mirror image, it's going to be an exact replica across some sort of strong reflector within the body. You can almost consider, for how strong of a reflector the diaphragm is, that it's almost like a second transducer within the body. We can see over on the heart here too, we're going to have an interface here with the lungs, and because of that, we're getting that mirror image. So we have our strong reflector here. You can see two aortas coming across. Some other tissue parenchyma is also coming across. It's an exact replica. Again, mirror image, exact replica across a strong reflector. It actually also occurs in vessels quite often, where that posterior wall is our strong reflector. It is important to remember that the true image is whatever is closest to the transducer, as the mirror image is reflected deeper into the body. So which vessel is the real vessel? It's going to be that top vessel. Mirror images are always deeper. So we have the sound coming into the body, hitting our strong reflector, bouncing into other reflectors, bouncing back to that strong reflector, and then back to the transducer. So again, the sound is taking different paths. It's not following a straight line anymore. And it's also bouncing off of different structures before going back. So it's not heading straight from the transducer to reflector and back. It's taking different paths. So which two assumptions did the machine get wrong? That sound is traveling in a straight line, and that sound travels directly to the reflector and back. To correct mirror image, we are going to decrease our overall gain, again, taking away some of the strength of that strong reflector, or we're going to try moving the transducer to a different way so we're not hitting that strong reflector at the same angle and hopefully reducing that mirror artifact that's coming across from it. So multipath artifact is similar to mirror artifact. In one way that it's different though is that it is not going to produce that exact replica. Multipath artifact creates similar structures, but they're kind of an amalgamation of everything that it's intersecting as it's creating that multipath sound traveling. So the sound beam path is going to be different to and from a reflector. This is going to appear more as a non-specific artifact that results in an axial error or a deeper artifact. And then again, it's similar to mirror artifact, but it does not produce that exact replica. To correct multipath artifact, we're going to change the path by moving our transducer, or we're going to change the angle that we're coming in at our region of interest. Here we have an example. We have a bladder. And as the sound is coming in through this bladder, it's kind of bouncing around on a few things and then heading back to the transducer. Because of the multipath that it's taking, the machine thinks that it's running into real cystic structures, and it now has displaced kind of an odd cystic structure off to the side, because that's where the machine has figured out it belongs. Here we have it again in trans. We have our bladder. Sound is coming in and probably bouncing around through there before it's heading back to the transducer. Again, the machine thinks there's this long cystic structure deep to where the actual structure is. This has to do with calculating that go return time incorrectly and displacing kind of this odd cystic structure. We also see it happen a lot with TEEs and the aorta. So we have the atria here, and then we have a strong reflector, and we have the aorta sitting behind it. Because of that multipath, we're going to get this kind of weird structure that pops right up in the middle of our aorta, and it can be easily confused with a possible intimal flap. So it's important as sonographers that you try different windows, try coming at things a different way to see if that is a true anatomical problem or is it just an artifact. In this case, in the second picture on the bottom here, this is a true intimal flap, and so we can see that proved with color, and therefore this is actually quite an emergency. We got to get that patient to surgery. Where in this case, if we call this an intimal flap, they got him to surgery and nothing was in there, you'd have a lot of people pretty mad at you. So we have to be very careful with our artifacts and that they don't cause incorrect diagnosis. So again, with multipath, the sound beam is going to enter the body and it's going to hit a reflector. Some of that information is going to head back to the transducer, but some just kind of heads off in another direction. And as it heads off in those other directions, it's going to strike other reflectors before returning to the transducer. So again, sound comes in from the transducer, heads back, a little bit of it might be displaced into another direction, hits something else before heading back to that transducer. The result is some sort of combination of everything that it hit, which is usually displaced deep into the body because of that go return time being calculated. So which assumption was broken then? It was that sound travels directly to the reflector and back. Multipath, lots of different directions that it's traveling before it heads back to the transducer. With refraction artifact, this is again another sound traveling in not a straight line type problem. The sound is sent into the body and then changes course during the transmission of the sound. The sound beam is going to strike an interface obliquely, and the media on either side are going to have different propagation speeds for this to happen. The refraction is going to result when true anatomy is displayed in the correct location and the pseudo-anatomy is displayed laterally or side by side. So with our first example here, we have sound coming into the body, and this really happens quite often with the rectus abdominis muscles. The sound's going to travel through these. Some is going to continue traveling forward, and some is going to take an oblique turn off to the side. What ends up happening though is that we have a true, in this case a true SMA, and a duplicate SMA is displayed to the side of it. So this is refraction artifact because we're getting that side-by-side displacement. Here we have an example of a fetal ultrasound very early. The sound is coming in and being bent by going through the bladder here. So some of the sound is hitting the true sac, and because some of that sound has now bent and going back to the transducer, the machine also thinks that there's something off to the side of it. So this would have been incorrectly diagnosed as a twin pregnancy, even though it truly is just a single IUP. So again, it's important if you're seeing these duplicated structures side by side to one another, you might want to think refraction artifact. And it's going to be a matter of changing your window to see if you can get rid of that artifact. So again, sound comes in, goes to that muscle, gets bent a little bit, hits the true structure, and then the sound comes back. A little bit of that sound is also going to come and hit a little bit more obliquely, and it's going to display incorrect structures to either side of the true structure. So with refraction, remember that it changes the direction of the sound as it comes into the body, and that you do have to have two different incident angles, and that it'll be laterally displaced. It'll go side to one side or the other of the true anatomy. So which assumption is invalid? That sound is traveled again in a straight line. To correct it, we're going to either change the path, we're going to move our transducer off to the side, or change the angle that we're coming in at the anatomy. Lobe artifact should sound familiar, as we've already studied this a few chapters back. But lobe artifact, we get side lobes that are created by single crystal or mechanical transducers, and then we get grating lobes, which are created by our array transducers. Both types of lobes are sound beams that are emitted from the transducer along rather than in the main beam. So we typically see those side lobes with single crystal transducers. They ride right along the main beam's axis, where our array transducers are going to create grating lobes that come off quite early in the sound beam. Both of these tend to be quite a bit weaker, so they have to hit a really strong reflector if they're going to cause an artifact. And again, as we move the transducer around, these grating lobes are also going to move, which will help to tell us if what we are seeing is actually artifact or is it true anatomy. The artifact is going to be created from a side-by-side structure, so some sort of strong reflector would need to be out here for this grating lobe to hit it and then be displayed within our main beam. Because of the side-by-side nature of lobe artifacts, these degrade our lateral resolution. So again, with grating lobes, you guys should already know this, but we can reduce this artifact through subdicing and apodization. Subdicing again is breaking those elements into a little bit smaller pieces. So if this is my PZT crystal, we can break it into smaller crystals, but treating them all as one. Apodization, if you'll remember then, is telling the probe to send out a really strong electrical signal to our more central PZT crystals, and then a little bit weaker signals out to those side ones. It just makes the main beam all that much stronger and makes our side grading lobes quite a bit weaker. We have a couple more examples of grading lobe artifact. So here we have an anechoic structure, but we're getting some little reflections within it. What's most likely happening is that there's something way over here that it's striking. The machine thinks it's all coming from the main beam, and because it thinks it's in the main beam, it's going to display it within our picture. Same with anything that comes across as like little dashes or lines or little speckly noise type things in our pictures. Those are typically grading lobe or slice thickness artifacts. So again, reflectors in the path of the side lobe or grading lobes will be displayed as if they were in the main beam's path. Objects that are placed at a proper distance, but in the incorrect location. So if this is our true anatomy over here, the machine thinks that it came from the main beam, therefore it's going to displace it in the wrong spot. So which assumptions are invalid? That all reflections are coming from the main beam's path. To correct it, again, we're going to change the path or change the angle by moving our transducer off to one side or the other, so we're not hitting that true anatomy with those grading lobes. Speed error artifact occurs when sound travels through tissue at a speed other than 1540 meters per second. The correct anatomy then is displayed, but it's going to be displayed at the wrong depth. We've already learned about the go return time calculations, so if the sound travels any faster or any slower than that 1540 meters per second, then the machine is going to calculate where that reflector should lie incorrectly. So it's going to appear almost as a step off or almost like a broken or a split or a cut somewhere within the anatomy. And this is going to result in an over or underestimation of distance from the transducer. So if there's faster propagation speed, echoes are leaving and returning to the transducer much faster than what the machine is expecting. And it's going to result in a shallow placement on the display. If you have slower propagation speeds, the echoes leave and return to the transducer much slower than what the machine is expecting, and it's going to result in a deeper placement of the display. So using this liver as an example, we have our transducer up here, and the sound is traveling through, and what is actually happening is traveling quite a bit faster through here. So as it hit the diaphragm and returned back, it took less time for that to happen than the rest of this diaphragm here. And so the machine calculated that out as just a little bit more shallow than what we had before. And with that, we get kind of the step off part. It almost looks like the diaphragm is broken. So the machine calculated it wrong because it was assuming that all the sound was traveling at 1540 meters per second. It also happens quite often with breast implants. The material that the implant is made out of causes the sound to travel at different speeds. So again, sound is coming in from the transducer. It may slow down or speed up through the breast implant material, and as it hits other walls and returns back, the machine just doesn't know that's what's going on, calculates it as if it was a 1540 meters per second. Then again, we kind of get that step off where it almost looks like there's a gouge in it or some sort of break. So it's important to try different paths and different angles again on these to see if we can correct for that versus calling this like an actually destroyed breast implant. Kind of similar to speed error, then we have range ambiguity error. And this is not a very common artifact that we're going to see, but it's still worth talking about. So in range ambiguity error, we're going to have objects that are out of the sector depth are going to be displayed into the image at a much shallower position. So again, this is similar to speed errors, but the echo from the deep reflector returned after other pulses had also returned. And this is going to make the machine think that there's a nearby reflector as it miscalculates that go return time. So say we have our body, and our image is only set to go in so far into the body. I'll just say this is at 10 centimeters, and we have this really strong reflector somewhere down here. The machine is going to send an echo out, and it's going to travel through, and most of that information is going to come back right away to the depth that we have set our machine at. However, some of that sound is just going to keep traveling, and it'll hit that strong reflector and come back. Well, the problem is that this echo that was coming down has already been calculated by the machine and was on a frame a couple frames ago. But now this reflector is just getting back to the machine, and because of that, it's being superimposed somewhere in our picture in a near field. The machine did not wait for all the echoes to return before sending out new echoes, so we get that range ambiguity error. To correct it, we're going to want to increase our PRP. The longer our PRP is means deeper imaging, so that's going to be increasing our image to get everything that we need. And it's also, with that longer PRP, we're going to get a decreased PRF, which means that the machine will wait longer before it sends out new pulses. Again, we can also try changing our angle. If we're not hitting that strong reflector at the same incidence to get that strong reflection, then it won't be displayed later. All right, so that was all the propagation artifacts. I know it's a lot, but go through each one and find out how each one is different and what assumptions they're violating. Pretty much for almost all of them, it's change how the sound is coming into the body to correct it. So keep that in mind. You'll just need to really pull out the main point of each one, see if you can draw each artifact, what it would look like if you were to see it on your pictures. In the meantime though, let's go ahead and do the test yourself portion. So number 1, how are reverberation and comet tail different? Number 2, how do mirror artifacts and multipath artifacts differ? Number 3, how are speed error artifact and range ambiguity similar? And number 4, again, think of a question that you might have about this lecture. When I ask in class if anybody has any questions, I'd love to hear what you guys have come up with.